I'm Dr. Catherin Harris, and if you clicked on this video because you're frustrated, confused, or even worried about why you can't reach orgasm, I want you to hear this first. You are not broken, you are not behind, and you are absolutely capable of change. Difficulty reaching climax is incredibly common for all genders and at every age. Many people don't talk about it because they feel ashamed or they assume it means something is wrong with them or with the relationship. But the truth is simpler and far kinder. Orgasm is a body-mind response that depends on physiology, psychology, context, and communication. When one or more of those pillars gets overloaded, the response shuts down. When we lighten the load and support the system, it often reactivates, sometimes sooner than you expect. Let's create a calm, practical roadmap together. In the next minutes, I'll walk you through why orgasm can feel out of reach and how to fix it with strategies that are safe, respectful, and scientifically grounded. Nothing here is about pushing yourself, faking anything, or following extreme trends. It's about building a foundation where your nervous system feels safe, your body has what it needs, your mind knows how to cooperate instead of sabotage, and your relationship, if you're in one, becomes a supportive space rather than a pressure cooker. Start by releasing the most common saboteur, pressure. Pressure hijacks the stress system, and a stressed brain does not prioritize a pleasure response. Your nervous system treats pressure like a fire alarm. It redirects energy to vigilance, not to sensation. That's why watching the clock in your head, mentally grading yourself, or worrying about whether you're taking too long tends to make everything slower. If you've ever noticed that the more you try to force it, the further away it feels, this is why. Your first assignment is remarkably simple. Remove orgasm as an outcome goal for a while and replace it with a process goal. Comfort, curiosity, presence, and pleasure without a finish line requirement. When you train like this, no timers, no milestones. You switch off the inner judge and switch on the observer, which is far friendlier to your body. Now let's explore the 4 pillars that govern your ability to reach climax: your body's readiness, your brain's permission, the external context, and the relational channel. Think of these as 4 dials. When they're tuned, the system works. When one is stuck at 0, the whole experience can stall. We'll go dial by dial. Body readiness means blood flow, lubrication or comfort, nerve sensitivity, pelvic floor function, and hormone balance. If circulation is low because you're sedentary, your body is dehydrated, or you're using substances that blunt sensitivity, it takes longer to build the sensations that crescendo into orgasm. If the pelvic floor, the ring of muscles at the base of your pelvis, is tense, clenched, or poorly coordinated, you can feel numb, uncomfortable, or stuck. If hormones are shifting, as they do after childbirth, during breastfeeding, with certain contraceptives, around perimenopause and menopause, or with low testosterone, desire and sensitivity can fluctuate dramatically. If there's pain from dryness, endometriosis, prostatitis, pelvic surgery, or scarring, your brain learns this isn't safe, and it quietly down-regulates the system to protect you. None of these are character flaws, they are solvable inputs. Brain permission is my shorthand for the accelerator and the brake inside your nervous system. The accelerator is everything that turns you on: sensations, thoughts, memories, connection, context. The brake is everything that turns you off: worry, self-criticism, performance anxiety, fear of judgment, trauma reminders, unfinished to-do lists, or simply being too tired. For many people who can't finish, it's not that the accelerator doesn't work. It's that the brake is jammed. The fix is not to slam the gas harder. It's to gently release the brake. When you calm anxiety, soften self-talk, and create a context that feels private and unhurried, your body often surprises you. Context refers to the environment and timing. Privacy, temperature, lighting, noise, interruptions, these are not trivial details. Your brain constantly scans for safety signals. If you are worried someone will knock, if your phone keeps buzzing, if you're cold, if you just had an argument, the scanning stays on and the pleasure response stays guarded. And timing matters. Many people expect their body to switch from task mode to intimacy mode in seconds. Most nervous systems need a ramp. When you let yourself transition, closing open loops, taking 5 to 7 slow, deliberate breaths, listening to your body, your stress chemistry drops, your heart rate variability improves, and your body becomes far more responsive. The relational channel is about communication and trust. When partners expect each other to read minds, both end up anxious. When partners treat intimacy like a test, both fail. When you can say what's comfortable, what's not. When you can ask for tempo changes, breaks, or more warmth, everything becomes easier. If you're solo, this still applies. Self-communication matters. Giving yourself permission to explore pleasure without judgment, acknowledging what you feel without forcing what you don't, and using tools that are comfortable for your body. Let's get even more specific. Why might orgasm feel unreachable right now? Medications are a frequent reason, especially antidepressants that elevate serotonin, some antihypertensives, certain antihistamines, and others. These can delay orgasm, mute sensation, or make it hard to cross the threshold. That doesn't mean you should change or stop anything on your own. It means a medication review with your clinician can be productive. Sometimes a timing adjustment, a dosage change, or a different option makes a meaningful difference. Hormonal factors also matter. Lower estrogen reduces lubrication and tissue elasticity. Lower testosterone can reduce spontaneous desire. After pregnancy and during breastfeeding, normal hormonal shifts plus fatigue can dampen arousal and orgasm consistency. None of this is a verdict. It is a map. Pelvic floor tension is another hidden driver. These muscles should be able to contract and relax rhythmically. When they're overactive, constantly braced, you may feel discomfort, a sense of blockage, or difficulty letting go into the rhythmic contractions that define climax. When they're underactive, weak, or poorly coordinated, you may struggle to build intensity. People often hear about strengthening, but relaxation and coordination are equally important. A specialized pelvic floor physical therapist teaches breath-pelvis coordination, down training for overactivity, and graded strengthening for underactivity. That work can be transformative not only for orgasm, but for back comfort, posture, and bladder control. Nerve health matters as well. Diabetes, certain neurological conditions, and pelvic surgeries can influence the sensory pathways involved in climax. Sometimes the solution is systemic: better glycemic control, targeted nutrition for nerve health, and exercise that boosts circulation. Sometimes it's local: gentle stimulation patterns your body actually perceives as pleasant, not intense inputs that feel like too much for a dulled pathway. The principle is the same. Give your body enough signal with enough time and comfort to learn. Now, how do you fix it without turning intimacy into homework? You use small, repeatable habits that reduce pressure and improve readiness. Think of this as your 4-week reboot. Week 1 is all about safety and nervous system regulation. Start by learning a simple 5-breath reset. Inhale through your nose for 4 counts. Exhale through your nose for 6 counts, 5 times. Longer exhales tell your body that you're safe. Practice this once in the morning, once in the evening, and any time you feel performance pressure rising. Add a sleep routine that protects 7 to 8 hours on as many nights as you can manage. Sleep deprivation increases stress hormones and decreases sensitivity to reward. It makes the accelerator sluggish and the brake heavy. Reduce buzzing distractions in your space. Close the door, silence notifications, give your brain the privacy cue it needs. If you're partnered, make a simple agreement. We're going to be curious, not hurried, and orgasm is a welcome bonus, not a demand. Week 2 supports the body. Hydration, circulation, and comfort are your 3 targets. Hydration matters for tissue comfort. Aim for steady water intake across the day, especially if you consume caffeine or alcohol, which can dehydrate tissues. For circulation, Walk briskly for 20 to 30 minutes most days. Add 2 or 3 short strength sessions per week. Body weight squats, hip bridges, gentle lunges, and stretch your hips and lower back. Better blood flow means better responsiveness. For comfort, consider a high-quality, body-safe lubricant if dryness or friction ever crosses your mind. The goal is to make comfort automatic, not a question. If you notice any discomfort, stop, address it, and only proceed when comfort returns. Your nervous system learns safety through these micro choices. Week 3 focuses on pelvic floor coordination and body awareness. 2 types of muscle actions matter: engaging and releasing. If you tend to clench when you're stressed, practice releasing first. Sit or lie down, place one hand on your lower belly, breathe down into your pelvis, and imagine your sit bones gently widening as you exhale. Think of a lowering elevator. No force, just a letting go. Do 10 slow breaths like this once a day. If you tend to feel weak or disconnected, add gentle engagement. On an exhale, think of drawing the muscles inside the pelvis upward a few millimeters and then releasing fully. Not a hard squeeze, and never hold your breath. 10 light repetitions once a day are plenty. If you have any history of pelvic pain, start with release and ask your clinician for a pelvic floor PT referral before adding engagement. Week 4 brings in mindful pleasure without a finish line. The assignment is to explore sensation, not to perform. Choose a time when you're not rushed. If you're solo, let this be about curiosity. What kinds of touch or rhythm help your body feel more present? What temperature of your space feels best? What breath rhythm keeps you comfortable? If you're partnered, communicate before you begin. The goal is relaxation and connection, not results. Ask for what helps you feel safe: warm lighting, slower tempo, fewer distractions. Throughout, keep returning to the breath pattern you learned. If you feel the inner judge show up, name it kindly and come back to sensation. If your body wants a break, take one. Each time you practice like this, you teach your nervous system to associate intimacy with safety and comfort again. Let's address performance anxiety directly, because it's the most common invisible break. Anxiety travels with a story. I should be faster. I should be able to finish every time. Or, my partner will lose interest if I can't. Those narratives spike stress chemistry and shut down the very sensations you want. Replace them with truths that lower pressure. Every body has different tempos. Pleasure is valuable even without a finale. And practice builds responsiveness. If you're partnered, agree on language you can use in real time to diffuse pressure. Phrases like, "Let's slow down," "I'm still enjoying this," "No rush," or "Can we change the tempo?" Keep connection alive and reassure your nervous system. You'll be amazed at how much easier everything feels when the stakes drop. We should also talk about distraction. Many people find their mind drifting to work, messages, chores, or self-criticism precisely when they want to be most present. This is normal in busy lives. The fix is not to scold your mind, it's to anchor it. Choose a simple anchor: breath, warmth, a soothing word like soften, or the feeling of your hand on your own skin. Each time your attention wanders, guide it back to the anchor, the way you'd guide a kind friend back to the path. If you're partnered, light, consistent communication is the anchor. That's good. Slower. Stay there. More gentle. Or let's pause. Guiding in the moment is not bossy. It's caring for both nervous systems. What about tools and devices? For some bodies, consistent rhythmic stimulation helps the brain and pelvic floor coordinate. For others, gentler patterns are better, especially if nerves are sensitive or you're retraining after pain. The principle remains comfort first. If anything ever irritates tissues or increases soreness, stop and switch to something more comfortable. Your nervous system learns through repetition, not intensity. If a particular device or pattern feels overwhelming, it's not right for your current stage. Choose the inputs that your body can actually perceive as pleasant. Let's turn to medical contributors more carefully. If you experience pain, unexpected bleeding, burning, or persistent discomfort, see a clinician for evaluation. Conditions like vulvar pain syndromes, endometriosis, prostatitis, recurrent infections, or scarring deserve targeted care. If you've had pelvic surgery or cancer treatment, nerve recovery and tissue health may need dedicated support. A team approach, your primary clinician, a pelvic floor physical therapist, and sometimes a counselor or sex therapist, can accelerate your progress. If medication side effects are significant, bring them up openly. This is a common conversation in medical practice. Sometimes small, safe changes have a disproportionately positive effect on arousal and climax. Psychological well-being is not separate from sexual well-being. Depression can flatten interest. Anxiety can tighten the body. Past experiences can leave protective patterns that show up during intimacy as a cautious break. Counseling is not an admission of failure. It's a sign that you're investing in your health. If certain memories or sensations bring up distress, a trauma-informed therapist can help you develop grounding skills so your body can feel safe again. You're not trying to erase history. You're teaching your nervous system that you are safe now, in this moment, with these choices. If you're thinking, this sounds like a lot, here's encouragement. You don't need to fix everything at once. Choose one lever in each pillar and begin. For the body, hydration and a short walk most days. For the brain, the 5-breath reset and kinder self-talk. For context, protect privacy and silence notifications. For the relationship, one simple agreement, curiosity over performance. Most people notice small wins within weeks, easier arousal, less pressure, more enjoyment, and, sometimes unexpectedly, spontaneous orgasms when they stopped demanding them. That surprise is a hallmark of a nervous system that finally feels safe enough to let go. Let me speak directly to those who feel numb. Numbness often hides two separate realities. Either sensation is actually reduced due to nerve or hormonal factors, or sensation is there, but it's overshadowed by stress signals. Approach both. Improve your baseline circulation and tissue comfort with movement, sleep, and hydration. If hormones are part of your picture, menopause, postpartum, testosterone changes, talk with your clinician about options that support tissue health and desire. At the same time, reduce stress inputs and performance pressure. Work more slowly. Give your body permission to build a warm hum rather than chasing a sudden spark. For many people, orgasm isn't a switch, it's a wave. You can learn to surf it. Now to those who say, I get close, and then it vanishes. That's the break again. The moment you notice you're close, you may tense, hold your breath, or think, don't lose it. Ironically, that thought makes you lose it. Practice the opposite. The moment you notice you're close, lengthen your exhale and soften your body, especially your jaw, shoulders, and lower belly. Let the wave come to you. Remind yourself gently, there's no rush. And if it ebbs, that's okay. Pleasure is not wasted just because it didn't crest this time. The experience teaches your nervous system that nearing the edge is safe, which makes returning there easier next time. If you've internalized the idea that you're too old, please release it. The capacity for pleasure does not have an expiration date. What changes with age is the physiology, circulation, hormones, and recovery time, and the toolkit you need becomes a bit more intentional. Warm-ups matter more, comfort matters more, patience matters more, but the brain remains plastic, the body remains responsive, and confidence often grows with experience. Many people find intimacy improves with age precisely because they have the wisdom to slow down, to communicate, and to prioritize authentic comfort over performance. For those in new relationships, the newness effect can cut both ways. Novelty can temporarily heighten arousal, but it can also increase anxiety. If you're worried about impressing someone, you're likely on the break without realizing it. Name the pressure, normalize a slower pace, and treat the early phase as an exploration. Two people learning how each other's nervous systems find safety and enjoyment. If you build that trust early, The rest gets much easier. If you're solo by choice or circumstance, that's not a problem. It's an opportunity. Learning your body without an audience removes performance pressure and lets you experiment with timing, breath, and comfort. Some people feel awkward at first. That passes. Approach it like any wellness practice, a calm setting, a gentle curiosity, and a generous timeline. The insight you gain will serve you in any context later. There's one more element that rarely gets discussed: your daily life texture. Pleasure thrives when your life has tiny pockets of ease sprinkled through it. If every hour is packed, your nervous system never downshifts. Create micro rests. A slow cup of tea where you actually taste it, a 5-minute stretch in sunlight, a short walk without your phone, music that loosens your shoulders. It may sound unrelated, but it isn't. A body that practices downshifting during the day downshifts more easily when you want it to in the evening. Some of you are wondering about timing. How long does it take to notice change? It varies. I've seen people feel a difference within days when they remove pressure and fix obvious comfort issues. Others need weeks as the nervous system unlearns old patterns. If pain is involved, or if you're adjusting medications, expect a longer arc and celebrate small wins. Response becomes more consistent when you stop measuring yourself. That's not a paradox, it's biology. If you've listened this far, you're already doing the bravest part, staying with the question instead of turning away. Let me give you a concise, repeatable plan you can start tonight. Protect privacy. Do your 5-breath reset. Check in with comfort. Is your space warm enough? Your body relaxed? Your mind at least willing? If you're partnered, share one sentence about what would help you feel safe, and one sentence about something that feels good emotionally: warmth, kindness, patience. Keep your attention anchored to breath or to a soothing word. Let go of how long and how close. If you feel your body asking for a break, listen. If you feel your body wanting a little more, follow that with curiosity. End on a positive note, with affection for yourself and for your partner if you have one, regardless of the outcome. Do this consistently, like a wellness routine. Your nervous system learns through patterns, not through exceptional nights. If after practicing with kindness and addressing the basics, sleep, stress, hydration, comfort, privacy, communication, you're still not seeing any progress, that's not a failure. It's a signal to bring in more support. Speak with a clinician about hormone changes, pain, or medication effects. Ask for a referral to a pelvic floor physical therapist if you notice clenching, difficulty letting go, or discomfort. Consider a few sessions with a counselor if intrusive thoughts or past experiences keep pulling you out of the moment. Your health is not a solo project. Getting help is not an admission of defeat. It's how we're designed to heal together. Before we close, I want to normalize the full arc of sexual well-being. Every body has seasons: stressful seasons with slower responses, restful seasons with quick responses, times of grief or transition when the body goes quiet, times of renewal when the body seems to rediscover itself. If you learn to befriend your seasons, you won't panic when one arrives. You'll adapt. You'll adjust your expectations, protect comfort, and keep the conversation going with yourself and with your partner. That mindset alone dissolves a surprising amount of performance pressure. Let's put this all into one simple statement you can carry. Orgasm is not a test you pass. It's a response your body allows when it feels safe, supported, and sufficiently stimulated in a way that suits your unique nervous system. You create the conditions, and your body does the rest in its own timing. When you stop forcing, when you honor comfort, when you slow down enough to feel what you feel, the system usually responds. Tonight, give yourself permission to be a beginner again, even if you've been intimate for decades. Beginners are allowed to be curious. Beginners are allowed to adjust. Beginners are allowed to say, "Let's try that slower," or "Let's pause," or "I'm enjoying this," even if there's no finale. If you let yourself be a beginner, you'll likely notice something remarkable. The very freedom to learn becomes the path to the results you wanted all along. I'm Dr. Catherin Harris. If this helped, take a moment to breathe, unclench your jaw, drop your shoulders, and decide what your first gentle step will be today. Maybe it's the 5 breath reset. Maybe it's a short walk for circulation. Maybe it's a kind conversation with your partner where performance is off the table and curiosity is back on the menu. Your body knows how to heal. Let's give it the conditions it needs with compassion and patience. You're not behind. You're right on time.